Hi, I'm Dr. Deborah Lascola with Cape Girardeau Urology Associates, and I'm here today to talk about constipation and how it relates to urologic complaints. Women report almost double the constipation rates of men, and nearly half of women that present to a urology clinic have constipation. Patients with constipation are more likely to have overactive bladder symptoms than the general population. And treatment of constipation is very important because it can result in significant improvement in overactive bladder symptoms. In a study of patients younger than 65 years old, their urinary urgency decreased from 65% to 31% just by managing their constipation, and their frequency of urination decreased from 80% to 48% after treatment of constipation. There are structural issues that are related to constipation, including rectocele, which is a prolapse of the rectum into the vagina, as well as rectal prolapse. There are also diet and lifestyle factors that contribute to having constipation. This can be relative inactivity or not drinking very much fluid. There's also medication side effects such as opioids, anticholinergics, which are drugs we use to treat the overactive bladder symptoms, as well as medications like antidepressants that can cause constipation. And then patients with inflammatory bowel diseases or diverticulitis, these patients are also more likely to have constipation, as are patients with spinal cord injuries, multiple sclerosis, Parkinson's disease, and other neurologic diagnoses. Many patients have diabetes, which is also a contributor to having constipation and also hypothyroidism. In addition, some people present with malignancies such as colorectal cancer as being constipated, and it's from obstruction of the mass that leads to that diagnosis. So first-line treatment for primary constipation is really focused on diet and lifestyle modifications. So increasing activity, increasing fluid intake, or maybe taking extra fiber, whether that's in the form of foods that are high in fiber or bulking agents to increase fiber. These are really the backbone of treatment for constipation. There are patients that have more of a defecatory disorder. Those will benefit from biofeedback or pelvic floor therapy. Almost any physician will encourage an active lifestyle, as being more active will definitely lower your rates of constipation. People who exercise daily will often have less constipation than patients that are taking a high volume of fiber. Good toileting habits are always encouraged. It's important to set aside some time to have a bowel movement every day. I can't tell you how many times I hear from patients that their normal is to have a bowel movement once a week. That's not normal. Really, patients should be defecating every day. Proper positioning is important when toileting. The hips should actually be slightly flexed, which can be accomplished by placing a small stool or support, something like a squatty potty, to help flex the hips, which helps to straighten out the angle for bowel movements and decreases constipation and intra-abdominal pressure that results in less strain. In summary, fiber is a really low risk and inexpensive strategy that can increase stool bulk and frequency, and therefore decrease constipation and help manage your overactive bladder symptoms and incontinence.